Heather Thome joins us from the Richland Hospital. She is an RN. She's a stroke coordinator. We've had her on the program before, but very appropriate to have her on again here during Stroke Awareness Month, during the month of May. Good morning, Heather.
Good morning. How are you?
Great. Seems like you were just here, and I think the last time you were here, you were talking about getting some of the blood pressure checks around at area libraries. How has that gone?
I think it's gone pretty well. I've heard from the Brewer Library that it's gone pretty well. Spring Green has told me a few things that's going well, and Lone Rock has reached out a few times, so I'm very excited that it's there and working on a second phase for the ER here in a few weeks, so I'm excited about that. Yeah.
Why do you feel that those are important?
So blood pressure management is very important for the prevention of a stroke. It's one of the American Heart Association's life essential 8 is what they call it. It's kind of what I consider the most important one. Blood pressure is kind of considered like the silent killer. You can have no symptoms of high blood pressure and all of a sudden you have a problem. So a lot of folks don't know how to take their blood pressure. They might be told by a provider, hey, you need to check your blood pressure. And so they just go on, Amazon or whatever. They buy a cuff. And there's a lot of research out there that shows that like 80% of the cuffs that you buy on Amazon are unvalidated or not checked for accuracy. And so having a blood pressure cuff that's accurate is extremely important. So these cuffs that are at the libraries are validated by the American Heart Association to be accurate. The kiosks that are in Richland Center and Spring Green are an accurate kiosk. So that's, important. So you're giving your provider a validated data that's been shown to be consistent and correct.
Every time we go to an appointment, that's the first thing that they do, other than the wait. But you check your blood pressure.
Yeah, they should probably figure out a better way to do that.
Yeah, they should.
Your blood pressure's a little high after you get your weight taken. But,
usually it is.
But the blood pressure is so important when it comes to stroke awareness as well, because there's a lot of research that shows even a 5-point reduction in your blood pressure reduces your risk of death by stroke by 14%. When I read that, I'm like, well, that's huge, right? 14% is a lot when you're looking at your risk of death. I'd do anything to reduce my risk of death, really. Yeah.
Right.
So, and around here, we're a rural area. Hypertension rates in rural areas are a lot higher, probably due to lack of provider availability. We're very fortunate that we have a facility, but if you look at nationwide, there's not as many hospitals in rural areas. So making sure that you're going to a provider and keeping those visits, because you don't want to become a statistic, in my opinion.
So the numbers for Richland County, have you had a chance to look at those recently?
I haven't recently. I've done a lot of data collection over my career for stroke, but it hasn't been horrible for our blood pressure stuff in this area. But nationwide, it has shown that, the rates of high blood pressure, 39% of adults in rural areas versus 32% in an urban area. It's a 7% difference. And I don't know if it has to do with, access to physical activity or just other aspects of healthy eating, et cetera. But, just making sure that you're going to those doctor's visits, making sure you're doing what they tell you to do. That's kind of a big piece. But yeah, I think knowing that in your head that statistic is there, you don't want to add to that.
With strokes, I guess with heart issues, a lot of times they'll talk about that being family history and hereditary. Is it the same thing for strokes?
Yeah, there is a little piece that can play into that. There's been shown that there's sometimes a familial link, not always. There are some traits that you can't control. There's an increased risk if you have a first-degree relative that's had a stroke that you might. Is that because of a genetic thing, or is it because of how you've been raised and how you kind of do the things your parents do, right? You're going to cook the same meals. You're probably going to engage in the same activities. So is it genetics, or is it, that nature versus nurture type thing? I don't know if they've quite figured that out yet. There's some research that shows that there is a few traits that are probably genetic that increase your risk, but not always. So I think controlling the things that you can control are super important. And I kind of touched on those life essential 8s. We talked about, the blood pressure one. if you have diabetes or if you're at risk for diabetes, controlling that blood sugar and making sure that's at a normal level, watching your cholesterol, watching your weight is another one, making sure you're sleeping okay. I think people underestimate how important sleep is. I mean, I love sleep. I love sleep.
It's my favorite hobby.
Same, right? But I think so many problems probably could be solved by sleeping, like having a good night's rest. And you see that so often, not being, when you wake up, you should feel rested. And if you're not feeling rested when you wake up, talking to your provider about that, maybe you have some undiagnosed sleep apnea that needs to get looked at. That'll increase your risk of having a stroke. So getting healthy sleep is so important. If you're a smoker, stopping, and don't start, I guess, is another one. Being more active. There's so many ways to increase your activity level. Just maybe parking a little bit further away or going for a walk with a friend. It's getting nice out, just finding those activity levels and just eating better in general. Those little 8 things can really increase your life ability to reduce your risk of stroke. So I think those 8 things just help so much. Yeah.
Are you seeing strokes at younger ages these days?
I have seen kind of a younger trend. I would say most of them, when I look at my data, are probably that 70, 80, sometimes 90. But every now and then I get one in there and I'm like, wow, what happened here? A 40-year-old or a 50-year-old. And I really am baffled by that. And I look at them and I'm like, okay, what happened here? How did this happen to this person? Sometimes I look at their chart and I think, wow, I wouldn't have saw this coming. And then other times I'm like, darn it. Like, man, if they would have quit smoking or if they maybe would have watched this cholesterol level or followed up with this, maybe this wouldn't have happened. Can't predict the future, but darn, there's been a few that are even younger than that. And those sometimes I think are a little bit of a fluke type thing. You can't control if a blood vessel bursts or something like that. But, you see them a little bit older, but every now and then you get those ones that make me kind of stop and really dig into why did this happen, just for my knowledge, essentially, and seeing what we can do to educate people better.
You've talked on the program before, Heather, about Be Fast. Could you go over that again?
So Be Fast is kind of the acronym that you're going to see everywhere to help recognize the signs of a stroke. For many, many years, the American Heart Association just used FAST for their acronym. But this year, I'm so excited, they decided to go with Be Fast, which helps so much to be consistent with messaging. So Be Fast talks about all of the signs you would see with a stroke. You won't necessarily see all of them at once. You might see 1, you might see 2, you might see a little bit of this, but we can kind of go over them letter by letter. So B stands for balance. You're going to have a sudden loss of balance. You're going to feel like you can't walk. You might veer to one side or the other, and it's going to come on suddenly. With all of these, you're not just going to have this gradual onset of dizziness or loss of balance. It's going to be like, holy cow, what's going on? So B is for balance, sudden loss of balance. E is for eyes, so sudden loss or change of vision. I've had a few cases of this, and being a science nerd, it always is so interesting. It's not interesting for the patient, but it's interesting for me as a clinician. They lose, a lot of times, half of their visual field, so they don't see anything out of the left side of both eyes. So all they see is their right visual field, or all they see is the left visual field, or all they'll see is the top of their eyes or the bottom of their eyes and of their visual field, I'm sorry. And it's all of it just happens. And you're like, whoa. Or they'll be like, it just got really blurry and I don't know why. And it's only with this eye, or it's only up here. And it just hits them all of a sudden. Or they'll be watching TV and they're like, all of a sudden I couldn't see part of the television. And so they come in, and sometimes we find it. They don't realize that it happened to them. We'll be doing a standardized test to look for how severe their stroke is. And there's a few things that we do for vision to see how severe their stroke is. And we'll test visual fields, and they can't see what we're doing in a visual field. And we're like, can you see this? And they're like, nope, sure can't. And so that's another one is eyes. E is for eyes. F is face. So this one, I think a lot of people, when they think of a stroke, a lot of times they think of this. It's the drooping or numbness on one side of the face. So if you're concerned someone's having a stroke, it used to be like, can you smile? I always think if someone's having a stroke, don't ask them to smile. It's not a fun thing. I always say, show me your teeth. And so you'll see a drooping of a side of the mouth. Sometimes you can see a little bit of the cheek droop as well, but it'll always be just one side. And then A is arm. I also like to say, or leg. They won't be able to lift that arm or leg. So if they think they're having a stroke, ask them to raise their arms. Oftentimes they won't be able to raise one of them. With an arm often comes a leg because they're kind of connected with the same neurology pathway. S is speech. Some people can't talk at all, and they'll be staring at you, and you can tell they're so frustrated because they want to get these words out, and they just won't come. So the inability to speak, or they will be speaking, and it's either super slurred or kind of garbly. So the words might sound like they have gravel in their mouth, and you just have to really, really listen. Or maybe the words are all mixed up, and we call that word salad. So those are some of the things that you might hear. So if you're a loved one that's coming with this patient to the ER, we might ask you, does this speech sound normal to you? And it's not because we don't trust the patient, it's we don't know the patient that well. And so we want to know, is this normal? When did this start? Is this speech sound okay? Do they ever sound like this? And it's because we need to know if this speech has happened before, or if this is there, or no, if they never sound like this ever. And then T is time to call 911 and terrible headache. So it's kind of a dual purpose letter. So sometimes you'll have like the worst headache of your life is how it's been described. Thunderclap headache. It just hits you out of nowhere. Some people might be like, well, I suffer from migraines. It's different. It is, people come in and they are in excruciating pain. Like can't open their eyes, can't sit still. They're in so much pain. And I always like to emphasize the time to call 911. EMS is the best way to get to the ER if you're having one of these, if you're having a stroke. They can let us know that you're coming. They can make sure you're not having a blood sugar episode. If we have warning that you're coming, we can make sure the CT scanner is ready. We can have all of our IV supplies ready to go. We can have the doctor sitting there ready, waiting. You kind of get treated like a VIP when you're having a stroke. We're all sitting there ready for you. So that's what the T stands for. It's just really important to remember they're all going to hit you suddenly. They're all going to affect one side. Strokes don't cross the sides. They like to pick a side, and that's it. So if it's your arm, your right arm, it's going to be the right side of your face. It's going to be your right leg. It's not going to be your right arm and your left leg. It's not how strokes work. So that's kind of important to think about. If you're having weakness in an extremity and you're still concerned, we want you to come in, but probably not a stroke, but it's always good to rule it out. So those are the things to think about and be concerned about. And I think with this EASY acronym, it's kind of easy to even teach kids, right? Like grandma or grandpa are having any of these things, you need to call 911 and get them help. So I think it's a pretty simple one to look at, to remember. Mm-hmm. Be fast.
Is there a chance you could have several of those symptoms or just one of them?
Yeah, one or several. And
everybody's different.
Everybody's different, and it depends on what vessel's being affected. They added the BE. The state of Wisconsin added the BE to be fast multiple years ago. And those two symptoms are often associated with strokes that affect the back of the brain. And so we call them posterior strokes. And those are so hard to diagnose because so many other things make you dizzy. So many other things. Right. Vertigo, dehydration, your electrolytes being messed
Inner
up.
ear thing.
Inner ear things. Yeah. So it was so hard to be like, how do you throw balance in there? But it could be a posterior stroke. And I've always said my favorite thing to do is discharge people. That is my favorite thing to do, is say, you're not having an emergency. you get to go home to your family. Like, I would rather discharge someone than give them the worst news of their day, right? Like, that is my favorite thing, is say, good job, thank you for coming in, all is good. Follow up with your regular doctor to get a bigger workup, but right now we can tell you nothing emergently is happening. And it feels so good. Like, that feels nice. Yeah.
But I think as a patient, you're kind of like,
you're like, darn it, I wish something was happening.
Well, yeah. Exactly. But I mean, maybe we're slow to contact because, it's just a headache, or, it's just, whatever.
Whatever, yeah.
It's not that serious, and you don't want to be a bother, and, I can see people feeling
Midwest
like that.
nice.
Yeah.
Midwest nice is
right.
what I like to call it. The other thing is I'll just take a nap. I'll just take a nap and it'll get better. Maybe not. It might get worse. With stroke, stuff is so time sensitive, and time is brain. One thing that I've noticed in doing this stroke coordination with looking at charts and all of that is, because I also look at our heart attack numbers, right? And people come in right away when they start having chest pain. But when it's a stroke symptom, they're like, I don't know, is it a stroke? And so they take a nap or they wait and see if it goes away. And it usually doesn't. Sometimes it does. But if you don't come in within 4 hours of your symptoms starting, we can't help you. Like, we can't give you a thrombolytic, which is a medication that breaks up that clot. And if it's a clot in a big vessel, you have to go to a big facility within 24 hours of your symptoms starting, and they can maybe go in and, I like to call it roto-rooting, but it's a thrombectomy is the fancy medical term, but they kind of roto-root that clot out and get it out of there to restore perfusion to your brain. And that has to happen within 24 hours of your symptoms starting. So time is a ticking, essentially. And time is brain, time is heart, for everyone thinks of that when they're having potential heart attack symptoms. But people still, I think, haven't really thought about that with stroke. And strokes are probably just as deadly as, a heart attack. And they're definitely more disabling. No one sitting in a nursing home with not able to eat something because they've had a heart attack. It's because they've had the sequela of a stroke. Their arms don't work. They can't swallow because they've had a stroke. And that's always so sad to see. It's like, if you maybe would have come in. I can't guarantee that the outcome would have been different, but we could have tried.
The odds were better.
Ours might have been better. Yeah.
Well, we're fortunate to have the Richland Hospital in this facility in the area, and because you guys are recognized, you have won some awards.
Yeah, we have. So I've been doing this program. I was trying to look it up the other day, how long I've been entering our data and submitting all of it to the American Heart Association. I think it's about 5 or 6 years now. And the first year that you do data submission doesn't count. They just want to see how you're doing. But then that second year, they tell you, good job, and you can start winning awards. And we've been winning an award for our stroke care since we have started and have not missed a year since. So we get looked at for how fast we get people to the CT scanner once they show up. If we're doing the standardized assessment, so it's called an NIH stroke scale, and it's called a dysphagia screen or a swallow screen, how fast they can get a medication to break up a clot, that needs to be given within 60 minutes of someone showing up. We need to get them to the CT scanner within 20 minutes, and then we need to get them this medicine within 60 minutes. So a lot happens in that first hour. If they're hospitalized here because they don't maybe qualify to get transferred, how fast do we give them their medications to prevent, like secondary prevention, like aspirin or Plavix, those types of things, or something to reduce cholesterol? Did we give them within 24 hours of them being hospitalized? And if they are getting transferred, did we transfer them quick enough? And these are all standards that are set for the entire country by the American Heart Association. We don't get special treatment because we're a rural hospital in southwest Wisconsin. They're the same standards for everybody. There are additional standards that are set for rural facilities that they want to see you do. Like UW-Madison doesn't get asked how fast they transfer people out. They don't transfer people out. We do. So those are extra ones that we get looked at for, and we consistently meet them year after year. We've gotten Gold Plus for the last 2 or 3 years. I met with our quality coordinator through the American Heart Association just a few months ago, ran through our data, and we're on track to win another one for our stuff for 2025. They don't release anything until the summer, so it's not official. But yeah, in the summer we should win awards again for our stroke and our heart attack care, which is fantastic to see that consistent care that our team is giving.
I've heard with heart attack symptoms, taking an aspirin isn't a bad idea. What about stroke? Is it the same?
It's not going to really do much.
Really?
Yeah, it's really want to break that clot up with this clot buster. Yeah. Yeah.
Interesting. Let's talk about some other things going on this summer. You have a teddy bear clinic coming up.
Yeah, I'm kind of excited about this. So Saturday, May 30th, we're having our first teddy bear clinic. I don't think we've ever had a teddy bear clinic at the Richland Hospital. At least we haven't since I've worked there, and I've worked there since 2008. So it's been a little while. Doing it in collaboration with the library here in town, and we are going to do a little story time. We're trying to figure out how we're going to make that work yet, but it's going to be from 10 to noon in the basement of the hospital. Going to have a couple different stations. It's really just to kind of help kiddos learn that the stuff that we do isn't as scary as it seems. So they're going to get a teddy bear, first come, first serve. When they show up, they're going to get a little name badge where they can say if they're a doctor or a nurse or a lab, whatever they want to be here at the hospital, and a teddy bear, and they're going to go to these different stations where they can fix a boo-boo, do a checkup on their bear, draw some blood from their bear. It's not going to be obviously real blood, but it's going to be like glittery. We're all working on it right now, and maybe give their teddy bear some medicine. And yeah, it's going to be really exciting. Do a little checkup on it and weigh it and measure it and check its eyes, do an x-ray. Yeah, we're really excited about it. I'm looking forward to it.
Oh, that should be fun. Lots of photo opportunities. I presume moms and dads and grandmas and grandpas can go along at the stations.
Yes, we would prefer that. Like, don't just drop your kid off. I'll have my own small child there, so I have to come with your grown-up. Whatever grown-up wants to bring the kid is ideal, but have to have a kiddo with a grown-up, or responsible party, I guess is how I should word it, to come with. But it should be a good time, and I'm excited to see how it grows and who comes, and I'm looking forward to it.
Good learning opportunity, and for the kiddos, I think it's a nice thing to show that maybe the hospital healthcare is not that scary after all.
Right. I think that's kind of our goal, right? And to see us, the people that are there, the employees that are there, they only see us a couple times a year, hopefully, right? And just to see us in a different way where it's fun. And so maybe the next time they come in, they can recognize a friendly face versus a scary time when they're maybe getting shots or getting, my daughter always talks about the time she got staples in her head. She's like, are we going to the hospital to get staples? I'm like, no, that was a one-time occurrence. Like, hopefully we're never going back for staples again. But that's what she associates going to the hospital with, is when she had to get staples in her head. So kind of getting these kids to think about, we're just moms and dads too, and we're here to show you guys that we're not that scary.
Sure.
Yeah.
And I mean, it's way off, but maybe you're planting a seed for somebody to be a healthcare worker someday.
I hope so. I'm going to need someone to take care of me someday.
No doubt. Thanks for coming in today. We appreciate it.
Absolutely. I love coming on here.
Anything else you wanted to add today?
I don't think so. I think we covered it all. Thanks for having me.
Great. Heather Thome, and for more information, contact your provider, but contact the Richland Hospital. May is Stroke Awareness Month, and the Richland Hospital is recognizing that today here on our morning show.